Good day everyone, this is Group 9. In this video presentation, we are going to tackle visual impairment. Before we start, let's have our learning outcomes first. These are the following learning outcomes. First, description of visual impairment. Second, manifestation of visual impairment. Third, strategies of teachers on how to deal with students who have visual impairment. Visual impairment. What is visual impairment? Visual impairment, also known as vision impairment or vision loss, is a decreased ability to see to a degree that causes problems not fixable by usual means, such as glasses. Some also include those who have decreased ability to see because they do not have access to glasses or contact lenses. Visual impairment is a term experts use to describe any kind of vision loss, whether it's someone who cannot see at all or someone who has partial vision loss. Many people have some type of visual problem at some point in their lives. Some can no longer see objects far away. Others have problems reading small print. These types of conditions are often easily treated with eyeglasses or contact lenses. Visual impairment may cause difficulties with normal daily activities, such as reading and walking without adaptive training and equipment. When one or more parts of the eye or brain that are needed to process images become diseased or damaged, severe or total loss of vision can occur. In these cases, vision can't be fully restored with medical treatment, surgery, or corrective lenses like glasses or contacts. This is Norijansi Kagay. I will now give the floor to Miss Christine Jade Handayan for further information about visual impairment.
Good day, I am Christine J. Zihandayan and I am here for the continuation of the description of visual impairment. Visual impairment is a very generic term and is divided into categories. These are the legal blindness and the low vision. So what is legal blindness? Legal blindness, which means the student has visual acuity of 20/200, which means they see at 20 feet what an average student would see 200 feet. Legally blind students will need major adaptations in their everyday learning. Legal blindness occurs when a person has central visual acuity, vision that allows a person to see straight ahead of them, of 20/200 or less in his or her better eye with correction. With 20/200 visual acuity, a person can see at 20 feet, what a person with 20/20 vision sees at 200 feet. In determining legal blindness, visual fields, the part of a person's vision that enables them to see what is happening to the side of them, is also considered. A visual field of 20 degrees or less is considered to be legally blind. Eye care professionals can assist in diagnosing legal blindness. For the second category of visual impairment, which is the low vision, what is low vision? Low vision indicates some functional vision exists. Students may need minor adaptations and may use optical or electronic devices to assist them in their learning. A person who is low vision has difficulty performing ordinary tasks with sight, even with the best glasses or contact lenses. In simulations of vision loss, about 80% of individuals who are blind have some remaining vision. It may be difficult to understand how an individual with a certain eye condition can see some things while not seeing others. While some people lose a lot of vision in a short period of time, others lose vision slowly. Many diseases that cause blindness begin to affect a certain part of one's vision and then progress to take one more vision. For example, macular degeneration initially affects a person's central vision, the vision that lets us see straight ahead. So that's all for the description of visual impairment and its two categories, the legal blindness and the low vision. So let's proceed to the manifestation of visual impairment to be reported by Cristil Ina Palanca.
Good day, everyone. So this is Cristalina Palanca, and I will talk about the visual impairment manifestation. So, what teachers should know. Visual impairment is a term used to describe any kind of non-correctable vision loss, whether it's complete blindness or partial vision loss. So, this visual impairment means it describes the any kind of non-correctable vision loss, whether it is the condition of the eyes or complete blindness or partial vision loss. So, the common refractive errors such as nearsightedness and farsightedness can be corrected with glasses or contacts, but when one or more parts of the eye or brain that are needed to process images become diseased or damaged, severe or total loss of vision can occur. In these cases, vision can be fully restored with medical treatment, surgery, or corrective lenses. Okay. These common refractive errors such as nearsightedness or farsightedness can be corrected with glasses or contacts. And it is true because in my condition, I'm a nearsighted person and right now I'm wearing glasses. So let's move on. Causes of visual impairments among kids and teens include amblyopia or lazy eye. It is a disorder or sight in which the brain fails to process inputs from one eye and favors the other eye. It results in decreased vision in an eye that otherwise typically appears normal. So next, strabismus or the cross eyes. This condition in which the eyes do not properly align with each other when looking at an object can alternate. Next, the birth defects and the eye or brain injuries. So, students with visual impairments may first need sitting accommodations to help them see you or whiteboards, blackboards, overheads, or display, etc. So, by this, they can able to see the writings on the board without any hindrance. Next, need to wear glasses, use magnifiers, or use extra lighting for class work. By these things are needed in order to read the text clearly. Next, require large printed handouts, materials, or audiobooks for reading. Need voice-activated computers or other assistive technology. Next, need someone to assist in taking notes. It is needed in order to check the notes if it is wrong or correct. Next, need extra time to get to classes or complete assigned work. Need to go to the school nurse for medication or assistance with visual concerns. And lastly, miss class time to see doctors. And that would be all. Thank you.
So here's Mary Chris Texon for the strategies of teachers on how to deal with students with visual impairment.
Strategies of teachers in how to deal with students with visual impairment. Students with visual impairment should be encouraged to participate in all classroom activities, physical education, and extracurricular activities. Make sure your classroom is easy to move around in and free of obstacles. Strategies of teachers in how to deal with students with visual impairment. Number 1, do not lower expectations because the student has a visual impairment. Provide mobility and orientation training as students with visual impairment experience great difficulty in acquiring skills in direction, mobility, and travel. This is particularly important at most primary level where the student may have to move for individual subjects. Arrange for other students to act as buddies, as use peer tutoring. Peer groups should be encouraged to include and support the student. Use the student's name when seeking his or her attention. Give clear instructions as the student may misinterpret gestures and facial expressions. Consider the use of enlarged print, magnified worksheets. Require less copying from the board or elsewhere. Increase oral activities. Use concrete materials and hands-on experience whenever possible. Allow more time to complete tasks and provide breaks to combat. Encourage the student to use visual aids, resources that have been prescribed. Set the student appropriately in the classroom. Make sure lighting is suitable. So, in order to deal with the students who have visual impairment, teachers must be patient in order to understand the situation. They are patient, concerned for their students, willingness to adapt, and knowledge of the subject being taught. If these characteristics are lacking, a teacher cannot be an effective educator. Patience may be the most important characteristic of all. Patience may be the most important.
So that's all from the Group 9 topic, visual impairment. So here are the reference of what we have tackled. Thanks for listening.